Hi everyone, today we're going to be talking about platelet clumps. So a normal blood film like the one on the right should have evenly dispersed platelets across the film. When a low platelet count is reported, one of the first things that we do after checking for clots in the sample is to make a blood film and look for platelet clumps. Platelet clumps are an in vitro phenomenon, meaning that they do not happen in the patient's body. It happens in the sample tube. It is an artifact of the testing process. To check for platelet clumps when reviewing a blood film, you start by following the green arrow around. You will check along the top edge, then you'll check on the tail, then you will check along the bottom edge. Platelet clumps often appear on the edge and the tail of the blood film, and they will be clustered together, sometimes in small groups, sometimes in larger, dense balls of platelets. You can also find them in the middle of the blood film. So image 3 shows several small groups of platelet clumps in the tail of the film. Image 4 shows one large platelet clump in the middle of a film, and image 5 shows a large platelet clump in the middle of the film as well. We will also look for fibrin strands, as the platelets can get trapped in them. On a blood film, fibrin morphology appears blue, and it's usually quite large and stringy. And as you can see on the far right, those blue dots are platelets which are caught up in the fibrin, and this will falsely lower the platelet count. If platelet clumps are identified, the lab will usually not report the platelet count. They might give an estimated platelet count. They might say it's mild, moderately, or markedly reduced or increased based on the amount of clumps and the size of the clumps that they're seeing. And they will typically request a recollect in a citrate tube and do a citrate platelet count instead. That's it from me today. Thank you for watching.